in the Hague. This is the center which we have built the last 3-4 years for prevention and treatment of child mental health. And when this war started, we gathered our professionals, and made our teams and visited the camps scattered around the city of The Hague. You know, about 2 months after the start of the war, the population in the city of The Hague increased, doubled actually, because of the huge number of IDPs, internally displaced people, who gathered in the city of The Hague and around the city of The Hague. And we could find the children, when we had our teams consisting of at least one child psychiatrist, at least one clinical psychologist, and one social worker, and even other professionals, allied professionals, who wanted to be connected with us, such as teachers or nurses. We found the collections of children like that. Children were left without care, actually, and it was not, of course, intentionally, but the adults were occupied with the issues of the war. Majority of the people of Shingal were captured in the hands of ISIS, and especially women and children, they were considered as slaves, and the men were killed directly. Those who escaped were in this tents, collections of tents around the city of The Hague, or inside the city of The Hague, in the families. They took them at the beginning. And there were a lot of children. You know, this society is a very conservative society, and the families are extended families. More than 3 generations are living in the same family, and the older person is deciding. And the adults follow the instructions from the heading, and more than 7 children per family, per parents, of course, are there. So there's a huge families, and children are a lot, and they are just moving around between the tents without anything to do. No schools, no play, no adults to listen to their histories and to take care or pay attention to them. So they gathered just around any person coming and asking them questions. It was an issue for us how to collect these children in groups, actually. This made us to think of some kind of intervention which must be short, must be group therapy, and must have many professions to be included. And we developed the SIPCA based on recent knowledge from these fields of science. First aid, that's both psychological first aid and the somatic first aid. Prevention, generally speaking, we know that prevention is better than treatment. And vaccination. Why we don't have vaccination in psychiatry? We have the vaccination in other medical branches. And psychological trauma may be one of the ways, the best prepared to develop such a method of prevention. Psychopathology is increasing in the significance in the new recent research and clinical work, and prenatal diagnosis is becoming more important nowadays because of the technical development. Early childhood investigations and interventions are becoming more and more of interest, even to prevent adult psychopathology. We depended on the multidisciplinary child and adolescent psychiatry character and brought our techniques from the cognitive behavioral therapy, which are most suitable in our society according to our experiences. And we depended mostly on salatogenesis instead of pathogenesis, as you understand. That's seeking after the origin of health instead of looking for the pathology. Recent trauma theories are also our origin for our procedures. SIPCA is a time-saving and cost-effective crisis intervention. It's early identification of symptoms, symptomatology among children, and at the same time we provide treatment for those who already show symptoms or kind of disorders. It is an evidence-based